We attempt to, using our slogan to make lives better by raising money for various things that the WHRA can't fund or isn't in their budget, and essentially trying to create community in this facility.
It's not just solely a veterans hospital. Yes, it was created over 100 years ago solely for the purpose of looking after veterans who came home from World War I, and then World War II, and then Korea. But because there's fewer and fewer veterans, well, the care has varied, and that has been the biggest surprise in all of this.
Probably the biggest misconceptions that people have about Deer Lodge is it continues to be a veterans hospital or that it's a large personal care home. And we have components of both those things, but certainly we have a much broader range of services and supports for the community. We don't have emergency department and we don't do surgeries, but every other service that you could find within an acute care hospital, we have here at Deer Lodge. So it really gives us a good ability to support whatever an individual might come through the door with. And so I see us moving out as a resource into the community to help individuals. We've had a couple of recent discharges out of our chronic care program where those are individuals that are highly complex. They've got medical instability. We've been able to restore their functioning and rehabilitate them. They've been discharged home. And so in the past, that hadn't occurred here, and we're really shifting our services to say, regardless of what bed somebody's admitted to or what clinic, our ultimate goal is to help them progress, to help them get to the least complex environment, and ultimately for many of the rehab patients or others, we want them going home, because really we're a large healthcare facility, and really no one really wants to be in a large healthcare facility, certainly for the rest of their days. And so we're trying to do that for the community.
I believe that based on all the feedback I've ever been a part of at the actual patient level, quality of service, every interaction that I've had where Deer Lodge was randomly brought up, it turns out that the individual has a family member, a dad, a mother-in-law, what have you, who raved about their experience here relative to where they came from. And so if I use that anecdotal evidence, I have to say I'm fairly proud of the facility that I'm attached to.
There is good in everyone, and we all have challenges, whether it's dementia, whether it's mental health, whether it's chronic illness, whatever it is, we all will face that at some point in time, and may not impact you when you're in your 20s or your 30s or your 40s, but once you start getting up into your 50s, 60s, then it becomes a reality, and I think we all have to be more aware of it. And if we can help you, and in turn you help us, then it becomes a really good thing.